On Distinguished Forum Member Emma Rawson Te-Patu.
Thank you, Madam Chair. I would like to support the earlier statement of my colleague of the Permanent Forum from the Ukraine this morning, and in addition I would also like to support the recommendations from the report presented by former member also from this morning on restoring Indigenous health by connecting systems through the Indigenous determinants of health, local to global evidence, and build on them both. Firstly, as an Indigenous leader in public health globally, I will state that peace and safety are prerequisites for health. That includes these halls and in these processes. These processes that are supposed to be created for us continue to be riddled with barriers for full and effective, meaningful participation, and we have experienced this in a number of ways just this morning. Ironically, on the day and first time this forum has focused on health specifically. An important point in this being that mental, spiritual and physical health are inextricably connected, which includes the symbiotic relationship of Indigenous peoples and planet. This must change. I call on Member States to recognise and take action to recognise that peace and safety are prerequisites to health, and in that I mean physical peace and safety as well as spiritual peace and safety. Recognise that war causes suffering, destroys health systems and worsens long-term physical and mental health outcomes, and not least leave long-term devastation on lands and the ability to live on lands in peace and safety. To recognise also that Indigenous health is inherently attached to land and the symbiotic relationship with lands and environments that sustain life. Member States and associated government systems must change processes where ongoing policy silos harm our Indigenous people's health because policies can contradict one another, directly impacting Indigenous health. They must assign resources realistically for achieving equity and the right to health for Indigenous peoples. They must recognise and adopt the Indigenous determinants of health and associated frameworks and evaluation methods to ensure coherency and consistency in approaches to Indigenous health globally. They must make decisions that ensure coordination across bodies leads to prevent harm in sectors and actual achievement of Indigenous health outcomes. They must support the proper coordination, development and implementation of the WHO Global Plan of Action on Indigenous Health and ensure that it is supported and properly resourced so it can authentically address the rights of Indigenous peoples and the Indigenous determinants of health. They must commit to valuing Indigenous intelligence and work in equitable partnership with Indigenous peoples to ensure the principle of free, prior and informed consent and self-determination are properly acknowledged and upheld. And they must ensure all action and decisions reflect governance and action towards the fact that health and safety are prerequisites to health, and health is a human right. Thank you.
I thank the distinguished